right, I guess we'll get started here. It's 4 o'clock. My name is Jessica Kuntz, and I'm a physical therapist for WellSpan. I just wanted to take a moment and on the behalf of WellSpan Sports Medicine, thank you all for joining us for our coaches clinic today, featuring Ed Briercheck discussing mental health strategies. Ed is a master's level PA licensed psychologist and also a state certified school psychologist. He states that the kids simply call him Mr. Ed. He works out of the Meadowlands or WellSpan Philhaven as a therapist and a member of the autism diagnostic team. Typically, when we had school, he worked there 3 days a week as a psychologist for the Lincoln Charter School in contract with WellSpan. He has been a licensed psychologist for 42 years and employed by WellSpan for 19 years. He has been interested in sports psychology all throughout his career. On occasion, he has done community presentations to students, parents, and coaches on various topics that include, but not limited to, sports, wellness, and mental health. He has been an amateur athlete since high school running days and continues to work out, cycling or kayaking daily. He states, on more than one occasion, WellSpan Sports Medicine has been there to put me back together after a mishap. A fun fact about Mr. Ed is that he's originally from Pittsburgh, and by extension, he's an avid Steelers fan. Before Ed gets started here, I just wanted to take a moment and say, if you have any questions, please use the question and answer feature, and we will answer all questions at the end of the presentation. Thank you.
Okay. Thank you very much, Jess, and welcome to everyone to my talk today. Chances are, over time, you've had an opportunity to come to one of my sessions on topics such as mindfulness or visualization or goal setting, in terms of working with primarily high school athletes. And I've always considered that both an avocation to my work as a therapist and a privilege, something that I've always enjoyed doing. Today, though, I come to you in a kind of a different way, and I'm going to ask your, maybe a bit of forgiveness that I take the topic in a different direction. And I think most of the audience will understand and relate to what I'm trying to get across. I've been in the York community for, as Jess said, a good 40-some years. Through most of that time, I've worked as a therapist, primarily with young people, kids, school-aged children, and certainly my share of adolescents. And as a bit of a specialty or side interest has been working with athletes, both in terms of what would you call your traditional kinds of clinical presentations having to do with, for example, a good one would be depression related to a sports injury. And, the feelings of grief and loss and anxiety that go along with that. In other cases, I've worked with athletes individually and in groups on increasing performance and working with mental strategies to try to get them to be more focused, improve concentration, and look at more what I think of as the traditional sports psychology approach. But this situation calls for a whole other level of consideration, and I'm very pleased to have the opportunity to talk with coaches, because I think you, as a group, are in a very unique place to help young people, not just in terms of the athlete, but just young people in general, because I think what we're going to see here in the next several months is, a very unique situation of adjustment and adaptation, emotionally, cognitively, socially, for the kids that we work with. So I'm taking this talk in a different way, and really, much like I wouldn't tell you what to do or how to coach, you wouldn't tell me how to be a therapist. But when you really think about it, coaches and therapists have a whole lot in common. And we, I think, hold a very unique place for those kids that are interested and willing to make the connection and to work with us. I like to think that relationships with coaches, counselors, school psychologists, therapists are really a very special kind of relationship. Certainly not to take away from the parents or grandparents on both, but it's one of those relationships where you get to see kids in their true and natural environment, trying to strive for particular goals, trying to make their way through adolescence, for example, perhaps moving on to college, trying to get into some idea of identity and where they fit in life. And isn't it our job to help them to get there? And we do that by virtue of our relationship, I believe, more than anything else. And I really believe it affects change primarily by who we are as people and our connection to those kids, as much as any technique, whether it be a coaching technique of how to make a block or how to, start a sprint, or in my world, how to reimagine a phobia, or how to deal with a specific fear, or or a problem in a relationship. I think what has to happen is you have to have that relationship first. And once you have that relationship, much can be gained in terms of helping kids through some difficult times. So, I've been thinking about this talk for quite a while, actually, and I've got 11 pages of notes, some of which I probably won't even take a look at, because I just really wanted to talk to you person to person on this subject. Prior to the COVID-19 thing, rates of depression in the adolescent population and rates of anxiety were, and of course continue to be, at levels of concern. I don't want to be overly dramatic about it, but we psychologists types love statistics, love to follow this. And so, for example, prior to the virus, depression in adolescents, and when I say depression, I'm talking major depression, serious clinical depression, was roughly about 5 to 8% of that population. Anxiety types of disorders run anywhere from roughly 3% to as much as 10% of the population. And seems to affect males and females in about the same levels. The ratio is pretty equal. So sadly, I've never felt like I'd ever be out of work. That there were always going to be kids that were struggling and would need help and support. And that's certainly proven to be the case through all these years that I've worked in the community. So then here comes along this coronavirus, and all of us have been affected. Here I am sitting in my basement, nicely styled in Pittsburgh Steeler memorabilia, by the way. I'm sitting in my basement talking with you when ordinarily I would come to you and we would have a face-to-face in an auditorium or a cafeteria or a gymnasium, and I could talk with you directly. I'm kind of old school. I still have yet to adjust to this, and I don't know if I ever will. So it's different for all of us. And I'm not sure things will ever be quite the same as we thought they would be. So early on, when I started to think about this, the first thing that popped into my brain when Dr. Deitch and his team started to talk with me about the kids that they work with, and obviously the kids that you work with, is, how are they reacting? How are they dealing with the sudden, and we all know it was a sudden loss of their ability to compete on teams, finish seasons, be together, build that camaraderie. I mean, you think about it, that was sort of the, what happened with everyone in high school. My grandson's a junior, finishes the school year just like I'm sitting here talking with you on a computer. But for our athletes, I think it was particularly challenging. I don't like to use the word traumatic because it has a lot of attachment to it, but I think in many ways it was traumatic for many kids, and I have continued to see certainly our adolescent group on this Zoom process to know that. So you have a situation where kids are struggling as it is, and thank God we have sports, and we have the camaraderie and the confidence building and the resilience training, to borrow that term, available to us through sports to help kids build their self-esteem and have some sense of competence as they go out into the world. One of the things that, and pardon me for rambling, but one of the things that always amazes me about sports, and I'd like to think that I'm one of those people. Not everybody is an elite athlete, but almost to a person, there's rarely the case that someone goes through a sports program and doesn't come out for the better. A lot of that has to do with connecting with teammates. Certainly a lot of it has to do with the work that you folks do in encouraging, teaching, mentoring, and I think in probably a lot of situations, counseling kids who might not otherwise talk to an adult in a trusted kind of way. Speaking of those kids that are in that, I don't know what the percentage is, we'll say the upper 10% of those young people, you have to feel pretty bad for them, in the sense that here's a group who, probably have opportunity to earn scholarship, maybe compete at a high level, seniors particularly who, did not have that chance to sort of work that last final year through and have closure on their high school experience. So point being that, I think there's probably, though maybe a lot of adolescents wouldn't say it this way, but I suspect that there was a lot of reactive depression going on there. I suspect that there was if nothing else, what I would think to be a typical grief reaction. And I'm sure most of you are familiar with the stages of grief where, the trauma of the situation is such, you go into denial. This can't be happening. Are you kidding me? What do you mean I'm not going to go out tomorrow and compete? You're crazy. What are you talking about? This can't be happening to us. Not too far down that path, anger, when it suddenly starts to settle in and you realize, holy, this is real. And I've worked so hard, and suddenly that's being taken away from me through no fault of my own, which makes it even more challenging. To bargaining, if we'd have gotten it sooner, maybe we would have done other things differently and we wouldn't be in this situation. A lot of rationalization of like trying to figure out, put an intellectual spin on why this is happening to us, something that obviously no one really could predict. To then a sense of depression, perhaps, where it just really starts to sink in. And, certainly as these weeks have moved along, it's taken its toll. And then eventually to some level of acceptance. And in that phase, which I think many of us, and I say us as a population, I think we're getting there. Is the idea of, our reality has been changed probably forever. So imagine that in an adolescent, and imagine that in a person who's worked really hard. Most of the kids that I've worked with who are athletes are also good students. I mean, the two go hand in hand. These are kids that work really hard, and they're trying to make sense of all this. I had opportunity yesterday to do a talk like this, and it was more in the direction of stress management technique and that kind of thing. I didn't want to come to them and like, oh God, it's so bad for you. I didn't think that was, I wanted to be able to impart some coping strategies and some sense of hope, and things can be better. And I think they can, and I think they will be. Obviously, a lot of that hinges on what you as coaches do in these next several months in terms of how you relate to your athletes. And I think by virtue of the fact that you're even listening to this little talk says to me that you care about this, and realize that the mental health component, not only in terms of performance, but certainly in terms of, the development of these young people and their ability to get through this is pretty crucial. It reminds me of, probably older than most of you, but it reminds me of, when I was growing up, my father talking about the Depression. My dad grew up and lived in the Depression. And I don't know about you, but these past several weeks, I've really come to appreciate just what that must have been like for these folks. And you know what? They made it through. And they were tough. And they were tougher because of that experience. I pray that our young people will be the same. And I'm sure there will be casualties to this, but by and large, with the encouragement and support of people like you, and hopefully people like me and the folks at Sports Medicine, we can get them through. Okay, so what about this? You know, I think the first step, and I've had to come to terms with this myself. You know, you've got to deal with your own feelings about this whole thing. You know, if you think about it, we've now got a sort of a threefold set of stressors. Again, I don't like to use the word trauma. You have the sense of losing the season. Clearly, you have the uncertainty, but perhaps the hope that there will be a recovery here over the next several weeks such that we can get back to fall sports and save some of what was lost. And then thirdly, and I can't have this talk in good conscience without mentioning, you know, the events of the past week. This is June 2nd, and, you know, the country is in incredible turmoil. You know, and our kids are smart, and they pick up, you know, they're on top of things just as much as we are. And there's going to be emotional fallout to this that we, as parents, counselors, coaches, are going to have to address. Point being, I think we as human beings need to know kind of where we are with all of this. And I think we get there by reaching out to our compatriots. So if there's one thing, if you're not doing it now, I suspect you are. I saw the article in the paper this morning. It was really a nice article. A couple of the coaches from the county were talking about just, you know, how they're feeling about the season coming up and getting through and getting kids back to workouts. But, you know, one of the things I took from that article, if you haven't seen it, was that the emphasis on coaches reaching out to other coaches. And I can't help but think that would be just so important to know that you're not alone in this, and that talking together gives you an opportunity to work through some of your own feelings about you know, what's happened these last several weeks, because we've all been affected in one way or another. So I highly encourage you to do that. To me, being with you know, folks that I can communicate with, I have fellow psychologists, actually fellow old athlete guys that I sit and either ride or my bike or kayak or whatever. Our workouts become therapy sessions as much as anything else, you know, to kind of get some of this dumped off. It has to go somewhere. It just has to go somewhere. And the quicker we, and I include myself, and I say this as a therapist, the quicker we get to a point of our own self-awareness and feelings about, you know, how our lives have changed, the better we're going to be for the kids that we serve. And I'm convinced of that. I think probably the best way to do that is in camaraderie with folks of like mind. I can refocus here for a second. I'm guessing, no, I'm going to make the assumption that most of you have been in touch with most of your athletes over these past several months, regardless of what sport or even what season that you're in. And if you haven't, I strongly encourage you to do so. You know, what scares me, I think, the most about kids today, listen to me, kids today, you know, but it's true, and this whole isolation at home has only made it worse, is that the kids tend to isolate in their bedrooms, separate themselves, especially adolescents, separate themselves from parents. They're on the game machines, which I not against necessarily. I think there's a role for that. But if they were kind of separated from us before, us being adults, they're even more separated now in a lot of ways, psychologically. So I think it's important that, we reach out to those kids and make that contact, make that phone call. I'm guessing, especially in anticipation of fall sports, you're starting to think about doing workouts together, or maybe bringing kids in together for meetings, or obviously having Zoom meetings. That's just great, because it's going to be that connectedness that I think is going to really help kids through. Because if there's one thing I've learned in working with kids, is kids talk to other kids, probably much more often than they talk to anyone like us, or at least me as a parent or me as a therapist. Doesn't always work so smoothly. So having kids together and having them, connect and support one another is even that much more important for them as it might be for us. The thing I worry about, though, are those kids on the fringe. And I think, again, coaches are in a unique situation, much more than me. I can't just call people up and say, "Hey, how you doing today? I'm a therapist. How are you?" That doesn't work. But you are in a role where you have a relationship with a vast number of children, young people in some circumstances, where you can make that phone call and you can say, "Hey, this is Coach Ed. Just wondering how you're doing, just checking in, everything going okay." And I think even that little bit of contact can make a huge difference in the life of some of the kids that I see being kind of on the bubble. And what do I mean by that? So, going back to where I started with, what about those kids at 3%, 5%, 10%? What about those kids? Well, those are kids that certainly can be athletes, but those are also kids who, may be living in homes where there's abuse or neglect, or living in homes where there's food insecurity. Certainly a lot of us have struggled with, changes in our financial situation. There may be an increase in marital tension, more arguments in the home. So kids that kind of were a little iffy in the beginning, it may be just that much harder for them now. So I think your being able to reach out and make those connections is vitally important. So what do you look for? And I'm guessing you've had these kinds of talks from professional folks before about this, but any sudden changes in behavior are kind of these red flags, changes in mood. In adolescents are squirrely as a rule. I say that with respect, but they are, what you see in one level is not what's really going on at another level. And I'm talking about emotional levels here. So, for example, you get kids who, have a fair amount of irritability, disrespect, anger, kind of that interface stuff, where maybe they didn't have that so much before. I mean, some of that's typical adolescence. You can write it off to some of that. But, that's a kind of a go-to defense mechanism for adolescents, meaning that those kinds of behaviors and attitudes and feelings are often covering up something else. Could be that anticipation about what's going to happen next. You know, am I going to get into college? Is my family going to have enough money to send me? Am I going to get that scholarship now that the scouts can't see what I'm doing? To, you know, things going on at home with mom and dad, or other, you know, financial or even, you know, problems with housing or basic needs like food, you know. My point being simply that what you see is not always what's really going on there, and you have to dig a little bit. And the way to do that, uh, uh, in some ways, is very simple, which is, you know, to be true to yourself, to be who you are, and to be willing to listen. Um, I call it listening with intention, and some people might use the term active listening, you know, and that involves the ability to really pay attention to not only what's being said, but how it's being said, and what the emotional content is behind, you know, the statements that are being made. It's been one of the real frustrations of this Zoom thing for us therapist types. This is a two-dimensional world you're looking at. I'm used to having people sit in my office, and you know, you pick up much more of the nuance of the communication. I forget the statistic. Most of the, I think, what is it, 70% of communication is nonverbal. I'm throwing that number out there, but it's a significant number. You know, this Zoom world kind of slows that down. You, hopefully, in the very near future, will have the opportunity to see kids in real life, and you know, maybe be picking up on some signals that other people aren't able to see. The point, though, kind of go back to where I started, is to be able to listen, to reflect, to frankly act in a non-judgmental way, in a neutral way. You know, it's easy, and therapists are good at it too. I mean, it's, you know, we're full of advice. We can tell you what to do with that relationship. You know, let's face it, coaching is by definition and by nature. I mean, you're here to learn something, and I'm going to teach you how to do it. This might require a different approach. This might just require your being the strong, mature, available, and trusting adult that you are, and to hear what kids are saying, and be able to understand where they're coming from. If you can do that much, you'll have done a tremendous service, I believe, for the kids that you work with. I think the last piece to this then is, well, what do you do with that? You know, what if I find somebody who's really depressed and is suicidal, or, you know, thinking about hurting themselves? And you know, statistics are, back to the statistics, you know, suicide is the third leading cause of death in the adolescent population. Well, you know, clearly, to the degree you're able to involve a student's parents and make that connection with the family, and get that child some help, is ideal. Sometimes I think kids will use the relationship of a coaching or mentoring nature to exercise a plea for help. And you may be just the person to get them to where they need to be. So you're not alone, is what I want to bring out. You know, we here at WellSpan, and I'm not just selling WellSpan here, but we here in healthcare are here to help you. And if you're comfortable doing so, you certainly can reach out to the folks at Sports Medicine. You can reach out to people on my side of the fence. I work for what's called WellSpan Haven. As you know, WellSpan has become a pretty big organization now, and a percentage of that capacity is devoted strictly to behavioral health. And I have some phone numbers and some contacts here to give you in case you do run into a situation, you just need some advice. Hey, I want to run this situation past you. What do you think? How do you how can I go about this? There are people available to help you to do that. I also think, because I'm assuming many of you as coaches are associated with school districts, it's always a good idea to build a relationship with a school guidance counselor or someone in administration, counselors or the school social worker are always good connections to have or resources to have. The school psychologist, where I work, I often say to myself, I am the school psychologist. I mean, staff come to me, and I'm glad for it, regularly with concerns they have about not only the kids in their classroom, but maybe their own kids or situations in their own personal life. Having somebody like that, a go-to person to be able to run a situation by is invaluable. And most folks in my world are very familiar with the greater array of services that are available in the community and can help you make those linkages. So while you have an obvious responsibility here, you're not alone, and there are many of us here that are available and willing to help, because we, as much as you realize, these next several months are going to be both interesting and challenging, and we want to help you to get there. And as important as anything else, want kids to get back to enjoying themselves and being able to be a part of a team and compete and and have reclaim their adolescence again. Okay, a couple of look to the end for this one. So here are some resources. And I'm going to give you my email, and so you don't have to write all this down. If you want to just even check back, hey, what was that phone number again? Just send me an email. I'm glad to respond. My email is ebriercheck, EBRIERCHECK @wellspan.org. EBRIERCHECK @wellspan.org. So if you come up against a situation, just some advice, hey, what do you think about this? I'm very happy to help you with that. We have in our county, well, in all counties, it's mandated. We have crisis intervention services available 24/7. These people are wonderful. They staff those phones around the clock. In our area, the number is 1-800-932-0359. That's 1-800-932-0359. We call it the Phil Haven Access Center. So if you give them a call, they can steer you in the right direction. As we all know, some of our kids, despite our best efforts, may be struggling with problems related to drug and alcohol abuse. We also, in our system, have what's called an addiction recovery support team. It's a fancy way of saying it's the DNA component to our behavioral health services, much like our crisis intervention services. but these folks are very skilled in the whole issue of treatment for drug and alcohol concerns. That number is 1-717-356-4323. 1-717-356-4323. That's staffed Monday to Friday from 8 in the morning to 8 in the evening. So that's another place to get some direction if that seems to be the prevalent concern. We also have what's called open access. And I know this probably all sounds alike, but we at WellSpan have a group of interns, pretty highly trained folks, to be honest with you, who are, during the COVID-19 crisis, are providing pretty near immediate access to at least short-term therapy. One of the problems that we've had in behavioral health, as you may or may not know, has been access over, this is certainly before the virus, people, it's a supply and demand situation, in that there's just been so many more concerns and not enough therapists, counselors to address them. Anyway, the interns have grouped together and have what we call open access program, where they can get folks in pretty quickly, even if it's just for a few visits until they can see someone longer term. That number is 717-812-5405. 717-812-5405. Here's my own little advertisement. Excuse me a second, let me throw that off. In conjunction with sports medicine, Dr. Mitch Crawford, who frankly is in charge of our drug and alcohol services at WellSpan, he and I are partnering up. We're going to do a support group for athletes. It's a free service designed to provide emotional support for kids during the coronavirus. It's an 8-week program directed toward high school athletes, male and female, roughly 14 to 17, meeting weekly beginning June 11th, next week at 4 o'clock. It's an hour group meeting, 4 to 5. Will probably be topically driven, meaning we'll start off with maybe a little introduction to something like goal setting or time management, stress management, mindfulness, you name the mental training technique. But our real interest is getting kids talking to each other. You can access that group through the WellSpan Phil Haven webpage. Go to what would be the main menu, and then to events, and you'll see it there. Again, it's free. Kids have to register. I personally make a phone call to the parent. That's part of the registration, just to let the parent know, hey, your son, your daughter's has registered to participate in this service. Are you okay with that? So we're going to start that next week, and it'll run for 8 weeks, and we'll just see how it goes. If you're interested in good articles related to coaching, COVID, sports psychology, a real good resource, and there's, as we all know, a gazillion things out there on the internet, but I always try to steer people towards websites that have some, professional accreditation to them. I like to direct folks to the website for the Association for Applied Sports Psychology. Association for Applied Sports Psychology. It is what it says it is, but these are the folks that hold the credentialing and the professional standards for folks who put themselves out there as sports psychologists. And there's just any number of resources there that they regularly put out, but certainly have amplified since we've started the services around COVID-19. A couple other little quick things and I'll let you go. I'm a podcast guy and I'm always searching for them. So I did a search so you don't have to. There's a group of podcasts that go under the title United. When I first put this together, there were 17 podcasts, which took the form of interviews with sports psychologists or psychologists in general about, again, behavioral health and how it affects athletes in the coronavirus situation. There were 17 that were out there between March 28th and May 8th. I'm sure there's more by this point. So you might want to take a look at that. Again, it's simply listed as United. And there's another one that I thought was really, really neat was and it's put out by the NCAA. It's simply called the NCAA Social Series. Maybe some of you are familiar with it. They did 6 episodes on COVID-19 sports just a couple of months ago. Probably they're still developing topics around that. So that's another good one too. Okay, I think that is all of it. Again, if you're needing direction, if you're seeing a student, an athlete that you think is in trouble and you need some guidance with that, reach out to one of us, either at Sports Medicine or me at WellSpan Behavioral Health, and we'll do our very best to try to get you the assistance that you need. So thank you very much.
All right, Ed, we have a couple questions here. So this question is from Rebecca, and she asks, you kind of touched on it, but what advice would you give to those who work with athletes or patients who need help but won't seek it professionally? And then part 2 of that is if they come to you for help and you know a mental health specialist would truly benefit them, I guess, how do you make that transition and what's the best way to go about it?
Okay. Well, it's interesting. In Pennsylvania, I don't mean it to sound this way, but I'll say it this way. You know, parents can drag their kids to counseling up to the age of 13. Parents have the say, you know, you're going to go do this. And then it's the therapist's efforts to cajole that child into, hey, this is going to be okay, you'll be fine. However, between the ages of 14 and 17, you know, kids, young people themselves can decide on treatment. So you can't make a 14, 15, 16, 17-year-old go to therapy if they don't really want to do that. You know, my thought to that is trying to involve maybe another intermediary, which might be, for example, the school counselor or frankly, a coach, someone who has has had more time with that person, and you know, maybe sit down with them together and try to work on that. Clearly, it's the rare situation, you know, that you can just go to therapy and, you know, not tell your parents. I mean, you have to involve the family at some point. You have insurances and all that to deal with. But I think to answer that part of the question, it's you got to go to somebody who has that trusted relationship in the first place, and try to move them along. In the end, short of saying that they're going to hurt themselves or hurt someone else, you're really kind of stuck. If I can say this to the second part of the question, whether that becomes a successful enterprise, I believe, I'm kind of old school on this. I think that if I'm a physical therapist, for example, and I'm working with an athlete and they're sharing some things, and you get them to a point where they may be willing to see a therapist, I think it's a great idea to frankly call somebody like me or Dr. Crawford and maybe get a little background, get some advice, and see if you can kind of it's sort of like coaching or even therapy. Not every therapist works with every person, and a lot of times if you can find the right connection, so for example, some folks, particularly I think females, are most comfortable talking to female therapists. So you want to have somebody kind of in the background saying, hey, let me work on that for you, and let me see if I can make that connection. A lot of times just doing that much bridges that transition nicely, and also prepares that therapist for, hey, here's what's coming down the road, and that person's maybe not 100% invested in this, just so you know. And that really helps the counselor when they start to work with that student.
I like that. And then my question was, it kind of goes along with that, and I think you somewhat answered it, but how about breaking down the barrier to an athlete who you can see those signs that you talked about earlier, and you think that they could possibly benefit from help, but they're not someone that's actively seeking help. How do you kind of go about breaking down that barrier and taking it that next step to try and get them some guidance?
Well, I think there's, to me, it's all about outcomes, and I don't mind being just a tad manipulative to that, in the sense that our situation is unique because we can offer athletes not only the traditional therapy counseling relationship, but we're also able to offer the mental training aspect of it. So it may not be 100% genuine, but it's safe. And I'm not trying to look for referrals and saying all this, but it would be, I think, legitimate to say, hey, sports psychologists might be the person you might want to talk with because they understand this kind of thing, might be able to give you some ideas as to how to improve your performance. And who knows, maybe you'd eventually get comfortable enough that you'd want to talk with them about it. I know somebody who, and try to approach it that way. In other words, it goes back to the whole stigma of mental health. And, I don't want to go talk to a shrink because there's nothing wrong with me. One of the points that I've often made with student athletes is to say, look, you've got a lot of strengths, you've got a lot of resiliency. Look at what you do every day. You're struggling with an unhealthy situation, but you're otherwise a healthy human being, and you have a lot of coping mechanisms. Here's somebody maybe help you figure this out, and take a more neutral kind of response to that.
Sounds good. And then last question we'll end with. I think every coach has dealt with this at some point, but this is maybe a little different of a question from what we've talked about with the theme today. But how would you advise coaches to deal with the situation of playing time? And you always have the kids on maybe that don't get as much playing time, that are just, I hate to use the term role players, but you know, they might not just be, how do you make them feel part of the team and keep them engaged and not let them get discouraged by that?
Well, that's a hard one.
That is a tough one. I think all coaches have dealt with that at some point. So
Well, yeah, yeah, and you know, I don't know. I look at it kind of a long-term sort of. I look at it differently, I'm sure, than a coach would look at it. You know, to me, you know, student athletes' ability to have some level of participation and some connection goes such a long way. And I'm looking past, you know, your senior year. You know, the things that you do now pay dividends many years down the road. And you know, I think kids they're pretty sharp. I think they know that, you know, I'm not maybe putting all the effort in, or I'm maybe not the best athlete here, you know, on the team, but I'm out here and I'm working and I'm doing it. So to me, it comes, I think it's better to include than not include. Because I think it serves the greater good. I think more people will benefit, how would you say, more broadly than to be more specialized and only put the best players out there on the field. Easy for me to say. I'm not a coach.
no, I think that's a great answer, and that's why I asked you the question, right? Because I think that is a different mindset than you would hear from a lot of coaches, but that's why I wanted to hear your take on it. And I think there's a lot of value in that. Certainly, I like that. So I appreciate the time today. You got any other closing thoughts? I don't think we have any other questions. So.
No, I think that pretty well covers it. I would just encourage people to reach out if they need some assistance getting just some advice on how do I handle this particular behavioral health concern. Doesn't always mean that student athlete's going to end up in therapy, but you know, if you feel like you're out on the tightrope a little bit, there's lots of us around to give you some guidance.
Sounds good. Thanks a lot, Ed.
Thank you, and thanks to everyone for listening.
All right, everyone. We will have tomorrow. We have our Wednesday full body workout. Friday we have a fun core workout. That's a good workout to follow along with. So hope to see everybody tomorrow, and we'll go from there. Have a good evening.
Bye, everyone.